finally, we'll deal with health professionals in rheumatic and musculoskeletal diseases, competences, professional standards, and mobility, probably the non-physician health professionals. And this will be addressed by Professor Thea Vliet Vlieland from Leiden University in the Netherlands.
Please. Mr. Chairman, ladies and gentlemen, many thanks for giving me the opportunity to talk about this important topic. And as we've learned from previous presentations, the burden of RMDs in Europe is high. Research from the EUMUSCNet surveillance project showed that about a quarter of the population suffers from or has suffered from musculoskeletal and rheumatic conditions. And although there have been enormous advances in the medical treatment of RMDs, including new drugs and joint surgery, many people still experience limitations in their daily activities and societal participation. To effectively cope with their condition, the majority of people with RMDs need, apart from the medical treatment by physicians, also care provided by additional health professionals like specialist nurses, physical therapists, occupational therapists, or other. These professionals may not only provide additional care in addition to medical care, but they can also take on extended roles, for example, in the case of shortage of physicians. Indeed, access to a team of health professionals with various professional backgrounds is an internationally accepted standard of care in the management of RMDs. It is recommended in several international guidelines, an example of which is shown on this slide. This slide shows the necessity of availability of a multidisciplinary team in the EUMUSCNet standards of care for rheumatoid arthritis and osteoarthritis, acting as a guide for patients and healthcare providers. The professions represented in the RMD multidisciplinary team, as shown on the previous slides, are all so-called regulated professions. Regarding the mobility of regulated professions across countries, there is ample regulation and legislation. It should be noted, however, that the process of mobility requires the individual recognition of qualifications for most professions, except for physicians and nurses where there is automated recognition. It's also important to realize that there is considerable variability within and among countries within regulated professions. For example, multiple professions may be represented within one regulated profession, and some professions may not exist in every country. Now, the question is to what extent there are challenges regarding health professionals' mobility. Indeed, when we are looking at the figures of mobility of the professions represented in the RMD multidisciplinary team since 1997, mobility is found to be considerable. In particular, there are many nurses and physical therapists, apart from doctors, moving from one country to another. But despite a considerable extent of mobility, there are also challenges, and these challenges have been extensively studied and described by various European bodies and other organizations in various quite voluminous reports. But, given the topic of today's conference, we would now like to focus on issues regarding health professionals' mobilities in the context of RMDs. For that purpose, we performed a survey among representatives of organizations of health professionals specifically working in the field of RMDs, and the survey focused on barriers and facilitators, impact and policy recommendations. The survey was done among the members of the EULAR Standing Committee of Health Professionals in Rheumatology. Currently, there are 22 countries represented in the Standing Committee, and the board is constituted by Christina Opava and Anthony Redmond, who is also present here today. Of course, this is not science, but it gives you a flavor of what's going on. In total, there were 12 responses, and one national president indicated that he was insufficiently familiar with the topic. The barriers that were reported were firstly administrative issues in the process of recognition of qualifications. Secondly, responders indicated that variation in the definition and scope of practice among health professionals from the same profession among countries could hamper mobility, and they also mentioned differences in the competencies and training across countries, and variation in the role and autonomy of health professionals in different healthcare systems. Finally, some country presidents indicated that there was variation in the standards of care across countries, and this could form a barrier. Regarding the impact of immigration, either positive or negative, less than 1/3 of the respondents thought that immigration would have an impact on the coverage of the provision of care in their country, and somewhat more respondents thought that immigration could influence the quality of care in their country. For the impact of immigration, about half of the respondents thought that it could have an impact on either the coverage or the quality of care. And to give you a flavor of the considerations regarding immigration and immigration, some quotes from respondents have been recorded. The considerations on these slides refer to immigration. Migrating health professionals are motivated and stimulated by the perspectives that other countries offer, and a growing number of health professionals leaves our country in order to work abroad. The main reason, low salaries in our healthcare system. And yet some more thoughts on immigration. Those health professionals will bring the knowledge and experience to implement in our country the guidelines used in the care for people with RMDs. And immigrated health professionals can be helpful in bridging the cultural and language barriers for immigrated patients. Regarding patient safety, language and required skills were considered to be important topics by some country representatives. The ability to communicate with the patients, to explain the problems, and to educate him or her is inherent part of the health professional's work. Without mastering the language, it's not possible to employ such persons. And highly skilled and experienced health professionals are needed. But most curricula from immigrating health professionals are insufficient, and additional education is required. We also asked national presidents about suggestions or recommendations. Regarding the process of recognitions, the following suggestions were made. More practical support of the process of mobility, the provision of clear guidelines regarding mobility by national governing health professionals' bodies, and an online forum for health professionals to ask questions and to see what the country is like to work and live in. Regarding education and standards of care, apart from more attention for the education of health professionals in general, a need for more similarity regarding qualifications and postgraduate training of health professionals regarding the management of RMDs was expressed. With respect to standards of care, a better implementation of the international multidisciplinary approach and guidelines on the national health level system was advocated. And finally, a plea for a European approach toward the estimation of the numbers of health professionals needed in RMDs, and a solution for the variation in salaries was made. To conclude with, the mobility of health professionals relevant for the management of people with RMDs is considerable, in particular nurses and physical therapists apart from physicians. The impact of mobility was, however, found to vary largely among countries. And national representatives of organizations of health professionals in RMD suggested the need for uniformity of qualifications and competencies of health professionals, specifically regarding the management of RMDs, international standards for health professionals' postgraduate education, and a better implementation of international standards of care in the management of RMDs. Finally, some made a plea for a joint approach towards workforce planning and income of health professionals and interventions to diminish the language barrier. Thank you for your attention.